We're here to talk about the surgical options for people who are suffering and living with obesity.
And joining us to talk about this is Dr. Luciano Fiszer, General Reflux and Bariatric Surgery Specialist at Elite Surgical Miami. Welcome to Smartlife, Doctor.
Thank you for having me.
Tell us, what can bariatric surgery do for somebody?
Oh!
Physically and
so much.
Spiritually. We only have 8 minutes.
And emotionally.
And emotionally.
Let me just start by saying that this is not weight loss surgery. So now we call it metabolic surgery, which sounds, fancy.
And why is that?
Because you're not just treating the weight, the excess weight. You're treating with an operation or with a treatment that includes an operation. You're getting rid of diabetes, high blood pressure, sleep apnea, high cholesterol, reflux.
By eliminating all that weight.
Infertility,
wow.
Decreasing the risk of cancer, solving lower back problems, solving knee problems, pain, all with an operation. What I tell my patients is, we're going to take care of that, and the weight will come off.
That's fantastic.
Oh, that's interesting.
So it's not just weight loss surgery.
Which I would think, don't get me wrong, losing the weight is fantastic, but I think all those health issues that you mentioned are much more important in the long run in someone's life, let's be honest.
When you look at patients that underwent bariatric surgery, because we have studied this, and we compare the same group of patients with another group that had no surgery, just lifestyle changes, we saw how that group in particular who had the operation decreased the risk of dying 9 times. In a 5-year period, okay. Yes.
Wow.
Okay.
So we're talking about life-changing events, operations that will increase your life expectancy.
That's fantastic.
I've met a few overweight people, very, very overweight, and I've asked them, are you thinking of doing a bariatric surgery one day? And they said, well, I went to the doctor and I'm not a candidate for that. What makes somebody a candidate for the surgery? It's not just the weight, obviously, being overweight. What's the determining factors?
So now we go back to the BMI that we had mentioned before. So if your BMI, when you go to your smartphone, you calculate your own BMI, if your BMI is greater than 40, you already qualify.
Can you go over BMI, because that was a different segment we spoke about?
Absolutely. So the body mass index is a calculation based on your height and weight.
Okay.
Very simple. You put those numbers in, it will give you a result.
Okay.
If that number, that result, is higher than 40, you already qualify, because we consider you carry enough overweight to qualify.
But you also have to have other health.
If the BMI is below 40, but it's between 35 and 40, and you do have some of the medical conditions that we just mentioned, you are also a candidate.
Okay. Very good. Okay. I want to talk about the 3 types of surgeries, because I know a lot of viewers out there, and maybe we even have someone out there that says, you know what, I need to do something with my life and help my health. There's 3 types. You brought fabulous pictures to show us. Let's start with the first one and walk us through exactly what it is. And then I want to know which one is your favorite. Gastric bypass.
So that's the gastric bypass. The gastric bypass is the oldest operation that we still offer. It has 2 components. As you can see on the left, you have a normal stomach without any kind of operation done. And the one on the right, you can see how a small portion on the upper part of the stomach is divided.
Okay.
And then we also reroute the intestine so that the food, when it comes into the stomach, is restricted, because now you have a very small portion of the stomach where the food is going through. You can see that on the right side, and the food would be that blue line that's represented there. But we also have a mechanism where the food is absorbed much less, because it's bypassing part of the stomach and the small intestine. We don't remove anything, as you can see with that green line that represents all the digestive juices that come from the stomach. The liver also drains there, the pancreas also drains there, so all those digestive enzymes travel down that part of the intestine, and they meet with the food that comes from the other side, and then you can digest. This is a very, very good operation. Patients are expected to lose about 70% of their excess weight in a year, meaning that if you're carrying an extra 100 pounds, during the first year, I expect you to lose approximately 70.
Because you're fuller faster?
Because you are fuller faster, but you also have hormonal changes that will help with that weight loss.
Okay.
So that's the gastric bypass. Out of the operations that I'm going to present here is the best one for type 2 diabetes. It's the one that has the best results in resolution or remission of diabetes. Because there's an immediate effect by having the food go through a different route and bypassing the duodenum, which is the very first part of the small bowel. And so there's some hormonal changes, and we see results right away. We can see sometimes patients that come into the hospital and they're on insulin, and they leave the hospital off insulin.
Okay.
And that can happen.
Great, doctor. The next graph we're going to talk about is called a sleeve. A sleeve gastrectomy. Say that.
Gastrectomy.
Gastrectomy.
That's a big word.
So the sleeve gastrectomy is, out of the 3 operations, the newest one approved by FDA, and it's nowadays the most popular operation.
That's the gold standard now?
I wouldn't say gold standard. I would say that's the most popular.
Okay.
Okay. Again, on your left, you can see a normal stomach. On the right, you can see a stomach after a sleeve gastrectomy. So during the sleeve, what we do is we cut a portion of the stomach, which is approximately 70% of the stomach. And the stomach that's left, it's shaped as a tube or as a banana. Okay. There is removal, complete removal of that portion that we cut. Okay. And with the sleeve, you're also restricted, so you can hold less food. But there's a specific hormone that's mostly produced in that part of the stomach that we remove. The name is ghrelin. But that hormone makes you hungry. So
you lose that hunger.
You lose the hunger too.
I have so many questions, and we have limited amount of time. But one thing that comes to my mind is there a... I see the advantages here, okay? Is there any disadvantage to cutting that much of your stomach out?
Not really. We
Nothing.
haven't seen severe or significant problems down the road once we follow those patients. So it's a very safe operation. With the gastric bypass, there are some differences between those. As you can see, you have 2 connections, so the risk of the complication profile is slightly higher with the gastric bypass, and I think that's one of the reasons the sleeve gastrectomy is more popular nowadays.
All right, let's take the last one, doctor, which is the adjustable gastric. Let's see if we have that picture and show that to our viewers, and tell me how much you like this one.
So
this one looks like you're choking the stomach.
So the adjustable gastric band, very popular about 10 years ago. The companies were advertising this. The operation, during the operation, you place a ring around the upper part of the stomach. That ring is connected via a small tube to a small chamber that goes under the skin. And the band has cells inside, so if you inject more fluid, those cells get bigger and they will create more restriction to the passage of food. So it's a purely restrictive procedure. Again, very popular about 10 years ago. We started seeing some issues with this along the development of the gastric sleeve that has much better results than the lap band. So right now, the lap band is a very small, it's about 2% of all the bariatric procedures done in the US. So definitely not as popular as it was 10 years ago.
Question on the first 2 methods, you're actually making the stomach smaller. There's a small compartment. So are you still getting enough nutrients? Because you're not getting as much food before. Are you still getting the proper amount of nutrients for growth?
Great question. So you are, but we also have to supplement with some vitamins.
Okay.
So we recommend all these patients to take, we should all be taking vitamins. We just don't. Okay. But it's very important for our patients to take multivitamins, and there are a specific set of vitamins that we recommend, okay, both for the sleeve and the gastric bypass. There are some other operations that are offered, okay, but these are definitely the 3 most popular ones. Let me just also say that these operations are done through small incisions. We don't make big cuts anymore. We don't do open surgery. They're performed through small incisions, and we put a camera inside. We can also perform these operations with a robot, which is pretty cool.
Recovery's fast as well.
So what we see, the main difference between the open operations and the laparoscopic or minimally invasive operations is recovery time. Patients are in the hospital either for 1 night or 2 nights. They go back to work in just a few weeks. So the recovery is really, really fast.
Interesting.
Thank you so much for the information. I hope you come back, because I have a plethora of other questions regarding all these surgeries, and I'm really curious about them. So I expect you to come back, please.
I'll be happy.
But you're in good shape. You don't need it.
Well, it's not
Doctor.
for me. I just know it's such great information, and I just I need a follow up here.
Absolutely.
Thank you, doctor.
Thank you.